morning, ladies and gentlemen, and welcome to the IBC Chat Show. I am your host, Nandita Roy. Today, we are joined by Mr. Aditya Narayan, a dynamic entrepreneur who has made significant strides in the health technology sector. After completing his business management studies, Aditya founded VRoots during the height of the pandemic in India, later expanding to the UAE in 2023. VRoots is among the select few companies globally offering an AI driven, smartphone based lifestyle modification program that can assess genetic and metabolic risks for over 250 health conditions and provide personalized solutions to prevent them. Building on this success, Aditya recently launched Limoverse in the UAE, a blockchain based ecosystem connecting health practitioners, institutions, and health seekers in a decentralized platform. Aditya's innovative vision in health tech is guided by his father, Dr. Sajeev Nair, who brings over 3 decades of experience in health and wellness to the table. I welcome you, Mr. Aditya Narayan, to the program.
Thank you. Thank you so much, Nandita.
Now, introducing to you our interviewer, Sir Sohan Roy. He is a dynamic maritime professional, Forbes enlisted entrepreneur, founder chairman of the Aries Group of Companies, a multinational consortium of 76 companies operating in 29 countries. He is the director of Oscar selected Hollywood venture Dam Triple Nine, the mastermind behind the revolutionary US $10 billion project Indywood. Among his notable achievements are the launch of pioneering ventures such as the world's first maritime TV channel, Marine Biz TV, the healthcare focused MediBiz TV, the International Maritime Club, the IndyWood Billionaires Club, the World Medical Council, and the revolutionary HR Efficiency Enhancement Tool FSM. As the founder of the Ares International Maritime Research Institute, Sir Sohan Roy has spearheaded the concept of the industrial doctorate, transforming AMRI into the Indie Varsity, revolutionizing education with artificial intelligence, career design, and educational 3D theaters. He was honored with the knighthood of Parte Guelfa in Florence, Italy, for his humanitarian activities and notable contributions to spreading the message of environmental sustainability. I welcome you to the show, sir.
Hi, thank you.
Yes. Sohan, sir, I would kindly request you to take over the session now.
Hi, good morning, Aditya. Welcome to IBC Chat Show.
Thank you so much, sir. So it's a immense pleasure for me to be here and have a chat with you.
Actually, I'm so delighted to introduce youngsters in our IBC Chat Show. And you
Yeah.
are one among that. And you are not quite new to the industry because your father is already a quite famous personality in the business circle.
Yep.
So let us start with your early days story. Tell us about you.
I actually started off as soon as my studies got over. I normally say this because I am not a person with any corporate experience. I just entered into the corporate world with a startup. So basically, I did my BCom and then I did my MBA. After which I wanted to start something of my own, and as a result, came VRoots in the year 2018. So 2018, I completed my MBA, and then I went on to looking at various options as to what to start. And that's when I was actually stumbled and I didn't know what to start, to be honest. And that's when, yes, my dad gave me some insights. And in fact, he came in as a mentor and he told me that, okay, why don't you start something of your own in the health space? Because health and wellness is an industry as such, which is booming like anything. It's a $5 trillion industry already. So that is going in a big way. So why don't you look into something like that so that I can also support? Because he's a person who has an experience in that industry for the last about 25 to 30 years. So I thought, yes, that's a good option because as I told earlier, I'm not a person with a lot of corporate experience. So if I have a mentor like him on top and run the show in an operational level, that will be a big learning for me as well. So that as a result, we were searching about what are the kinds of gaps that are there in the market, and as a result, we came up with VRoots. So we will talk about VRoots more, but just the name as such, VIE, it's a French word which means life. So the entire concept of VRoots is from roots of life. So that is the entire concept behind starting VRoots. So we started in 2018, October 3rd to be precise. We went on to a MVP stage for the first 2 years, and November 1st, 2020, during COVID, we launched in India, and around in 2023 mid, we launched in the UAE, having our office in Dubai. So this is a short gist of our beginning.
Okay, good. Tell us something about your father first, because our viewers are not much aware
Yeah.
about his background.
Yeah. So he has been in the health and wellness sector since 1998. So he started off his journey by selling nutritional supplements, and he was holding a big network of people in India. So his name is Dr. Sajeev Nair. So he had been doing a lot of research as well. So more than a business as such, he had been into a lot of research areas as well in the health and wellness field as well. Since the last about around 5 to 6 years, he had been doing a lot of research in the domain of biohacking. So biohacking is a space which is emerging in a big way, so in India as well as in the MENA region. But in the US and Europe, it's already well known. People are talking about it. A lot of events are happening. A lot of companies are coming on board in the biohacking space. But in the MENA region, the scope is really big, but the awareness is pretty new, or in fact limited. So that's what he was doing a research on for the last about 5 to 6 years. But even before that, he had been doing a lot of research on neuroscience, and as a result, he came up with a paper called Thought Process Reengineering. So that's what his main focus and expertise is on, neuroscience and brain functions and things like that. So he got his doctorate. He's not a medical doctor, by the way. So he got his proper doctorate, not the honorary doctorate, the doctorate as such, for the paper that he presented for the thought process reengineering, which is connected with the neuroscience and the brain functions. So as a result, he also created a peak performance convention, an event which we do back in India. We have already done 10 events, which is called Rise Up. So that's actually not a motivational program. It's basically to do with your neuroscience, your brain functions, how to take control of your brain, how to come out of your limiting beliefs, these kinds of things. So the first time we are doing it in the UAE in April 27th. That's also happening in Dubai. So that's a happy news to share in this platform. So that is a brief about him. And he started off a wellness company back in 2013, 2014. That period, he started a company which was into Ayurveda. We had a few products, about 9 products, based out of Bangalore. And then after around 2 to 3 years, he sold that company to another company, and he was having a relaxed, research oriented life. That's when I came into the picture, and we started off V Roots. So yeah, this is the background.
So basically, your business model is Ayurveda based or allopathy based?
I would say neither, because we are what we are mainly doing is we are into personalized well-being. Or in fact, when it comes to human beings, we know that there are more than 8 billion people in this whole world. That means it is 8 billion plus different combinations or formulations that are there in the entire world. So what is good for me may not be good for you. What is it's already written about 25 to 30 100 years back. It was already written that one man's food is another man's poison. This is a quote which is already there. You can search and look at it. So this was told by a leading doctor back then. So what does this mean? If I have a chicken biryani in front of me, it may be good for me, but the same may not be good for another person. So the problem statement that we solved using V Roots is basically, if we take a look at a mobile phone or a television or a refrigerator or any kind of device for that matter, each of the device has a operating manual, how to do it, how to switch on, how to switch off, how to correct, how to rectify everything. But we human beings doesn't have an operating manual, which is the fact. But we are one of the most complicated devices in this whole world which God has created, and we need an operating manual. And my operating manual, and sir, your operating manual will be completely different. And how do we come to that conclusion, or how do we create an operating manual for each individual, is the question. Or that was the gap area which V Roots is filling. So we are basically into genetics. So we do genetic predisposition testing, not from a diagnostic or a disease centric, but from a preventive well-being angle. So we have a genetic test which tests about 275 plus health parameters, and from that we come up with a highly personalized recommendation plan for people. Like for example, you go through the test. It's called EPLIMO, epigenetic lifestyle modification. So you go through EPLIMO program. You The first step would be that with the help of 2 ml of your saliva, we would be doing a highly comprehensive genetic analysis, so genetic predisposition test. from which we will be getting the high risk levels of 275 plus health parameters. And from that, we would be creating a personalized diet plan, personalized fitness plan, personalized medication, personalized nutrition, everything included for you. So that means at the end of the day, what do you get in front of you is an operating manual about yourself. So you will be clear as to what is good and bad for you. You can clearly differentiate, because we are seeing a lot of you're big time into films. We all know that. So a lot of movie actors, a lot of celebrities are dying on the gym floor at the age of 30s and 40s. We are seeing that since the last about 2 3 years. Why is this? Mainly, it must be because of the fact that they are not doing what they are supposed to do. Now, how do they know what they are supposed to do? It is only through something like this. So that is our main core element inside V-Roots. And to support this, we have our products. Products not in the allopathy space. We have products in both Ayurveda and food supplements. So it's not medicines, it's supplements. So back in India, we have about 15 different products, sorry, 17 different products coming under the Ayush license and FSSI license in India. So out of which few of them are being launched in the UAE very soon. Within the next 2 3 months, we would be launching about five of them in the UAE market. So this is an overall scope of things that we are doing.
So the fundamental principle is prevention is better than cure.
Absolutely, absolutely, no
Uh,
doubt.
okay, so how the supplements? Because there is an argument that many supplements got side effects actually,
Correct.
because naturally it is coming up with different preservatives and other
Yeah,
things.
yeah.
So how do you ensure that your supplements have got no such side effects?
So mainly the ingredients that we use in all our products are all either FSSI compliant or FDA compliant. So because why we created all these products is with the intention that yes, definitely we want to launch in the US market. That's there. And hence what we did was that each of the ingredient that was pick chosen for all the 17 supplements were like compliant legally. It's like it's already proven and it's already accepted by the FDA that it is coming under this so and so category. So that is the surety that we have in terms of the kind of quality of the ingredients that we are using in all our products, and of course the kind of QC that goes through it, and the units, the manufacturing facilities that we are using, all are like top notch. It's not our own manufacturing facility. It's a huge 500 crore company back in India. They are based in Bangalore, so they are our research partners. So the entire manufacturing, QC, research, everything happens along with them. So it's actually like a joint venture with them.
Every individual is different. Everyone's genetic coding, everything is different.
Yeah.
So but when you are giving a supplement as a common thing for everyone, because you are not designing for each person. Okay, you have a
Yeah.
standard supplement. So
Yes.
how it can satisfy everyone, because each individual is different.
Yeah.
So what is the thought process about that one?
Yeah, that's a really good question. Mainly, suppose if, as I told you, I we have a range of 17 supplements. So we have never asked anyone to take all the 17 supplements. That's not
Yeah.
our main intention is not to promote the supplements in a big way. So that's why we have come up with the genetic program. So what happens is from the genetic program, it would be clearly mentioned as per your genetics. These are the kind of nutrition or these are the kind of vitamins and minerals that your body requires. Like, for example, suppose you go through your Eplimo program and we come up with a solution or we come up with a analysis which says that you are an individual or your body needs these vitamins. Like, for example, vitamin C, vitamin E, magnesium, zinc, vitamin D. Suppose these five. So out of these five, the first four, that is C, E, magnesium, and zinc, we have V-Roots already has the products and we know the quality of the products and we are 100% confident. But the fifth one, that is vitamin D is a product which we doesn't have. We haven't brought out vitamin D, but there are enough and more really good brands out there. So the suggestion goes to the customers as to, as per their genetics, what is required. That's the only thing that we provide to them. It's not like we don't ask them to take all the supplements randomly. It's completely based on their genetics. That's how we do it.
See, normally what happens is our journey starts from mother's milk actually. So
Exactly.
after that, the whatever food cooked by the mother, that is according, because in the early days what you eat that decides your basic metabolism, everything. Okay.
Yeah.
So
Yep.
at certain point of time, we get away from that food, and we start taking other things, and
Yes.
that deficiency start from there. That means each person's requirements are totally different, because what he was taking initially, accordingly the
Yeah.
body gets changed. Okay.
Correct.
So if
Correct.
you take a standard practice that okay, you need to have minimum magnesium this one, different elements this much. So how is it really going to satisfy? Because in the early days, maybe my body is already tuned to certain things, because my what my mother was giving, accordingly
Correct.
my body is actually accepting that one. Because food is
Correct.
the best medicine, and my early days food already decided my lifestyle. Because the normally all this obesity, everything starting when you start taking the external food, like
Foods
all
and
junk
things
food.
like
When
that.
you
Yeah.
start
Yeah.
eating, this thing happens.
Yeah.
But when you make a standard practice that okay, this is a scientific thing, but what is the role of this, the design done by the mother in the food habits?
So mainly, people used to ask us, what is the right time to do something like an Eplimo program? So people used to ask this, and our obvious answer is the day you're born, because the kind of data that we are retrieving, the kind of genetic data of a person that we are retrieving, is the data which of when I mean that data is something which has been coded in you when you were a zygote inside your mother's womb. So that is the data that's being retrieved. So suppose if a 40-year-old person is doing an Eplimo program, that's where this question becomes very valid, because he has gone through a lot of lifestyles. He has gone through, as you said, without any information. He must have gone through a lot of diet routines and things like that. So that's where what we do is, along with the genetic test, we do a proper metabolic analysis. Like, for example, suppose genetically, if we are seeing that there is a high risk for you for magnesium deficiency, just an example. Now, magnesium, the richest source of magnesium is green leafy vegetables. Apart from the supplements, if you look at the food source, it's green leafy vegetables. But when it comes to food sources, the problem is that the quality of the food sources that we are getting in the market right now is a big question. So that is where we get a bit stuck. Now, if that is the if that kind of a condition is being observed in the genetic analysis, that is, you have a high risk towards magnesium deficiency. Now, normally what we do is that we have a panel of doctors and geneticists working with us in house. They are on our payrolls. So what they do is that they ask the customer to get a magnesium test done. That is, presently, as per your metabolic analysis, what is the kind of magnesium levels and things like that that's happening. This is just an example. So that is being taken into consideration for the in the entire journey, and that's how the recommendation plan is being created. It's not just the genetic part, because genetic part is on one side, that is the base data, but another important data is your metabolic data, as you rightly mentioned. Like, where do I stand right now? How is my lifestyle right now? And what are the kinds of differences that I should be making from what I'm doing right now? I may be eating these ABCD right now. So now, from the ABCD, I need to cut B and D, and rather I need to include E and F. So that kind of a proper that is where the magic happens. It's not just the genetic; it's about the metabolism as well. That's the perfect question that you asked, because how we are living right now is a big question. Is a really valid point. So that is being considered in the entire journey, and that's how we create the lifestyle plan for people. So that's the answer.
So basically, what is this biohacking means?
So it's really interesting. The entire concept is really interesting, because in the US and Europe, when people talk about biohacking, it has gone to that extent as to inserting chips inside the body and creating cyborgs and things like that. So in a way, people or human beings are getting converted into robots. We can even say like that. But from our context or from our point of view, it's not. That's not biohacking. Biohacking is all about knowing yourself and taking those decisions in your life, so which are good for you. So that's mainly what biohacking is all about. It's actually a convergence of both eastern wisdom and western technology. Like, for example, in the US, they are not very bothered about the eastern wisdom. And eastern wisdom, the richest source is definitely our own India. So the kind of ayurveda, yoga, all those kinds of practices are the best traditional eastern wisdom. So we at V Roots, using or through this concept of biohacking, is actually trying to converge both these Western technology, which is the latest one, with Eastern wisdom. And that's where I missed to mention about that. We normally do a big convention called World Biohack Summit. So that happens in Dubai, and we have already done two editions. So the main agenda behind, or the main aim of that event, is basically to bring together these kinds of like-minded people and share maximum knowledge, and to this convergence of Western technology with Eastern wisdom that in practice happens over there. So it's actually a platform. So, like for example, last Biohack Summit happened in October 2024 in Dubai Marina JW Marriott. We had about 1,200 plus people, 38 speakers from the 15 countries, 25 brands in the biohacking space, all of them coming together and sharing knowledge. So this is the kind of way we are actually pitching in the biohacking concept. In fact, my dad has written a book which is called The Making of a Superhuman. So this book was written about 2 years back, and it's having a the forward was written by Padma Bhushan Mohanlal sir. So in that book we have mentioned about 150 plus biohacking techniques. So once you go through a book like that, you will be clearly able to differentiate, or you'll be clearly able to understand what biohacking is. It's basically about knowing ourselves and taking action in our lifestyle on a daily basis accordingly. What is lifestyle? From the moment I wake up today till the moment I wake up tomorrow, not till the moment I sleep today, because sleep is also an important, very, very important factor. So that's what biohacking is all about.
See, what is the role of blockchain in this one? Because in your
Yeah, yeah.
this app and other things, you always say the blockchain, have integrated blockchain into this one, into your
Yes.
app. What is it actually?
So mainly that's a separate project that we started along with this, and the name of that project is Limoverse. So the main intention, or the aim of that was around 2 years back, 1.5 to 2 years back. There was a big boom in the blockchain and the metaverse industry. So you must be knowing about metaverse for sure,
Yeah.
because in the event that happened in Queen Elizabeth, I heard you talk about metaverse.
Yeah.
So our main intention, or our aim, was to create something like a metaverse of or inside the health and wellness space. Like for example, just imagine a metaverse as such, a virtual world where people have started their centers. They provide their services through the centers. Like for example, there could be really good hospitals, really good clinics in the US. People from India or people from other parts of the world travel all the way to the US to take the treatments and get all those solutions. But rather than that, if there is a virtual world like that, and if the same solution can be received virtually through a metaverse, that would be the wonderful factor. And definitely, when it comes to blockchain and when it comes to creating a metaverse as such, it has to be a decentralized ecosystem. That's where we brought together the blockchain space. Like for example, in here in Dubai, we are partnering with a lot of centers, wellness centers, like clinics, fitness centers, normal wellness centers, dental clinics, all those kinds of centers. We are partnering with them. So now what happens is they are partnering with us by seeing the Eplimo genetic program. That's one thing. But in the long run, what happens is that once the metaverse concept becomes big, once that Limoverse ecosystem becomes big, these people can come into that ecosystem and be part of that decentralized ecosystem, provide their services to the entire community over there. And that's the main concept behind the Limoverse. And we made it inside blockchain mainly because we didn't want to make that as a company as such which rules the entire ecosystem. It has to be decentralized. People inside the ecosystem will take decisions, that entire system will move forward like that. So that's how we have created Limoverse, and we already have about close to 50,000 plus people in the Limoverse ecosystem. We have a Telegram channel for that, and we have an app which already has a download of more than 150,000 over the last 2 to 3 years. So that is going parallelly. So we club both these, or in fact, all these things that I told you about, V-Root, Seplimo, World Biohack Summit, Limoverse, all these things happens around the same ecosystem. So that once a person enters into the ecosystem, they have anything when it comes to their health and well-being. So that is the main concept that we have.
Actually, personally, where you stand, you are standing close to the allopathic way of living, or Ayurveda way of living, or a spiritual way of living, for just by natural way, like other birds, animals, they never go to hospitals. No, they
Right.
just eat the natural food and they survive in this world. Which one you prefer actually?
I think it should be a balanced combination because we cannot completely avoid hospitals, doctors. They have to be there. Once we definitely in this present lifestyle, whatever brilliant lifestyle we so-called brilliant lifestyle we possess within us, there could be chances that we fall sick and all those kinds of things happen. So all these things that you just mentioned, Ayurveda, allopathy, spirituality, all these things, mental well-being, a huge important factor. All these things should go hand in hand, is what we strongly believe. And out of that, we cannot contribute in all the ways. Like when it comes to allopathy, there are enough and more really good players. Ayurveda, there are really good players. So all of these things have players. Like for example, I mean that's where we are also coming into the picture. When we started, all these players were there, but that's where we were trying to find out what is that gap which needs to be filled. And that is where we came up with this concept of personalized wellness, or in fact personalized well-being. So we are there in that space in a strong way. We have all the kinds of tools, techniques, equipments, all kinds of products. Everything is there in place with us. So anybody who is looking for, okay, I need to live a preventative kind of a lifestyle, I need to live a lifestyle which is good for me, and that has to be scientifically proven, come to us. I am actually having a problem with my health, I want to treat it. There is allopathy, there is hospitals. I want to go for a dhara, or I want to go for some kind of a kayakalpa. There are Ayurveda experts, mainly back in Kerala. So all these convergence, I would say it's a balanced convergence of all this, which contributes to a betterment of people.
See, we are all from a land where Ayurveda was started, okay,
Yeah,
5,000 years back. So, Sukhano Bhavadu, like that, because those days, every day, those who were practicing Ayurveda, they were thinking like, okay, everyone should be in a fine form actually.
correct,
They
correct,
never dreamed of having more and more patients or something. But the
correct.
things are now changing, it is getting
Yeah,
diverted.
yeah,
Every hospital is looking for more patients. Every the medical related organizations, product manufacturers, they want to have the industry grow actually. That
correct.
means the number of patients should increase, their medical bill should increase. So it has gone to that level that now many people cannot even afford it actually, because
Agree,
even the the insurance premium is going up like drastically. And recent
agree,
studies
agree.
show that more than 50% of the medical things happening in, especially in countries like India, is unwanted, especially the
Correct.
surgeries.
Yeah,
And the root cause, yesterday only I read an article about that. The salary difference between a topmost doctor and the entry level doctor is 100 times difference.
correct.
Okay, so who is going to pay for this? Naturally, the patients. And unfortunately, this system has been created by people who coming out of the management schools, and you are a product from such a management school.
Yeah.
So, what is your thought process? We have worsened the situation because of this new management system or not? If when this medical industry was managed by medical professionals, there were certain ethics. Now the things are gone out of the hands. So,
Hmm.
what is your vision on this one?
Main thing or the vision itself, the result of that vision is what we have created, because definitely when it comes to preventive health, what we need to definitely focus on is to stay away from diseases. That's the main thing that we are also focused on. Because yeah, it's true, when someone goes to the, I still remember my father-in-law passed away as a due to lung cancer. It was his fourth stage. I remember those, it was not like he was bedridden for months or years or anything, nothing of that sort. It was just a matter of 2 weeks. So but those 2 weeks, the kind of spend that happened, the kind of the problems that he were facing, everything is something which I know. The same thing is applicable for everybody. Everybody would be having some kind of an experience like this. So what I would strongly say is that prevention is definitely better than cure, but at the same time, prevention is definitely cheaper than cure. That is what the concept which has to which has to really propagate in the minds of people. People has to look for solutions, and thanks to COVID, I would definitely say thanks to COVID, because those 2 years of uncertainty has created a mindset in a lot of people that I need to stay away from hospitals. I need to stay away from diseases. I need to look for solutions whereby I can lead a proper lifestyle. I can be at home, at the peace of my home with my family, and lead a good lifestyle. So that kind of an awareness has been created automatically, and in that way, I would thank COVID. So. Um that is the main thing. People, even the kind of awareness that we are trying to spread across the market is that you need to find solutions as to how you can lead your own way, or in fact what we say is that how you can become a biohacker in a kind of a branding kind of an angle. What we are trying to make is biohackers. How can we create, say, for example, 1 billion biohackers in the next 5 to 10 years? That is a kind of big picture that we are seeing. And once that happens, automatically this problem statement that you just mentioned gets solved, is what I strongly believe.
No, from your so far experience, have you done any statistical analysis or
Yeah.
research on this one? That one of your KPIs, like the medical bill of your customers getting
Mhm.
reduced or something like that? Because naturally, okay, you need to have more and more customers, but
Yeah.
same time you have a moral responsibility to make sure that when you introduce a new system, their health bill should not go up. It should
Correct.
converge actually. So,
Correct.
have
Correct.
you done any study on this one? Because of your efforts,
Yeah.
for their medical bills are going up or down, or this becomes your supplement cost becomes an additional burden on them?
So suppose, just imagine that a 30-year-old person like me is going through something like the this genetic analysis that we have, that is the EPLIMO program. And what happens is that I'm getting, as I mentioned earlier, I'm getting an operating manual for myself, and I'm leading my lifestyle in the exact way my genetics says. For which I have spent a certain amount. Like for example, for EPLIMO, back in India, we have priced it at 35,000 INR. So 35,000 rupees is what people pay for getting this, and we have EMI option, what all those things are there. Um, so this is a once in a lifetime process. The genetic part is a once in a lifetime process, because I do the test today or I do the test 20 years down the line, the result doesn't change, because as I mentioned earlier, this is something which we are decoding from the moment I was a zygote inside my mother's womb. So the information doesn't change. So this is a one time process that I go through. So from that, as I mentioned, I get an operating manual and I lead my lifestyle. So the possibility or the probability that I would say, for example, I just imagine that I haven't done something like this and I'm leading a lifestyle just like how I'm going right now. Maybe 3 years down the line, I may get contracted with some kind of disease, say type 2 diabetes hits me. And then it's a havoc. The journey is a havoc after that. But I go through something like this, I correct my lifestyle, and then within the next 2 to 3 years, I was supposed to get type 2 diabetes, but that I could push to maybe 10 years, or I could push it forever. That saves me a lot of money. Now, to do something, a research as such, or a proper analytics as such to be done for this, it takes a really good time, because we just started about 4 years before. And now people who have done, when we started in 2021, that time, all the customers that we have got, they have already created that lifestyle modification and they are living that lifestyle right now. So now the impact, or the financial impact, the health related impact, all those kinds of impact, positive impact that they will start to experience in their life happens in the long run. So a proper analytics from a commercial angle right now is a bit difficult, but at the same time, we are doing a lot of research from the health angle. Like, for example, in India, we have crossed about 10,000 customers who have gone through the entire EPLIMO program. So we have got 10,000 plus people who have got their genetic data. So it's a really crucial data. So from this, we are actually doing a lot of research. Our genetic team is coming up with a lot of papers, submitting those papers to the authorities. Like, for example, I personally met the Kerala governor, and I had submitted a report which talked about type 2 diabetes. So like, for example, out of a sample size, normally in US and all, we have seen research happening with a sample size of 50, 60 people. Now, we have taken a sample size of 100 people, out of which what we saw was that 85% of them was having a genetic high risk towards type 2 diabetes. Okay. And out of the 85%, around 90% of people were having something, the magnesium deficiency, high risk towards magnesium deficiency was seen. And type 2 diabetes and magnesium are closely linked, which research has already proven. There are enough and more papers which associates or which connects between magnesium and type 2 diabetes. Now, what is our research coming up with? Kerala as a state, from this sample, we could see that these many people are prone to type 2 diabetes genetically. And the same, out of those, around 90% people are having magnesium deficiency. Now, what is the solution? We need to come up with magnesium rich food sources. The government has to take initiative to come up with good magnesium rich food sources and make it available to the maximum possible way. So these are the kinds of research papers that we are creating on the back end. So the financial aspect of it that you mentioned, it will take time. It is, we are too early to create that kind of an analytics, but from the health related analytics, yes, we are doing in a big way.
But what is the guarantee or warranty you are giving for the end users? Suppose they start using this procedure or these supplements and
Yeah,
other for lifestyle, what you are recommending,
yeah.
they will get the result, and how fast they can get the, okay, because that visibility, how long it will take to for them to realize that the, okay, after following this one, I am getting the result out of that.
Yeah. So this cannot be considered like a like, for example, you go to a fitness center. We can clearly differentiate before and after, maybe in a matter of 3 months. It's clear. 3 months or 6 months, we are seeing before after. We have seen that for Amir Khan, Hrithik Roshan, everybody. We have seen that. But something like that is not possible over here. This is like, firstly, it's about the accuracy. The test accuracy as such is 96%. That means once I go through the test, the result that comes out, that is, it's saying that I have high risk towards these things. I have low risk towards these things. So that is 96% accurate. It is already proven because we use the most advanced technology that's available in the world right now, which is called next generation sequencing. That is the main name of the machine. So the result is accurate. Result, there's no problem at all. Now, from the result, I create or I implement those lifestyle modifications in my life. And when do I start to see the result? It depends on person to person. Like, for example, if that is being done by a 10-year-old kid, it's going to be a long process because at that time he doesn't have any problem. But on the other hand, if a 50-year-old person is doing that and he is already contracted with type 2 diabetes or any kind of anti-inflammatory disease or whatever it is, um, or autoimmune disease, that's also quite common these days. So some kind of autoimmune disease is there, and he is doing these kinds of lifestyle modifications. Maybe 2 years, 3 years down the line, he will be able to see a positive result even in that. But as I said, this is not a cure for that. This is a lifestyle modification plan that we are creating. So as a result, that could happen. That is the only answer that we can provide right now.
Okay, but during a saliva test, okay, you can identify maybe 250
Yes,
or 300 for things you can identify, deficiencies or whatever it is.
correct.
And suppose there's a magnesium deficiency. So, what is the difference between I am using magnesium rich food I am trying to use, or I am
Yeah.
using the supplements as as a curing system? So,
Yeah.
which will be faster or which will be more effective?
Absolutely supplements. Because
Hmm.
when it comes to the food sources, I'll give you an example to for easy understanding. Let's take an example of vitamin C. The same would be applicable for magnesium, zinc, everything. So vitamin C, we all know that the richest source of vitamin C is amla, nellika.
Hmm.
So amla, people normally ask us because at V Roots we have vitamin C, which is like 1000 mg. So 1000 mg vitamin C is like one tablet will be having 1 gram vitamin C. Now, if
Hmm.
you look at Google, if you search Google, there will be a statement which is coming under the FSSI rule, which says that 45 or 75 mg vitamin C is the only permissible, or that is what human beings should be consuming in a daily basis. But People actually take that screenshot and send it to us and ask that, see, the Google is saying like this, as per FSSI it's like this, and you are selling 1000 mg, isn't that bad for health? The answer is no, because 75 or 45 mg is called daily allowance. Okay, maximum daily allowance. It has a condition to it, that is under uh, what is that, ideal living conditions. Yes, ideal living conditions. So what is this ideal living condition? Without pollution, a proper lifestyle. So for that you may have to go to Himalayas. So in our lifestyle, like we are living in Dubai, we are living in Kerala, in our lifestyle it's not valid. That point is not at all valid. Now, to get 1000 mg of vitamin C from amla, I have to consume that much of amla. Like what we are providing, or the supplements in the market is providing, they are taking extracts. It's not the same amla that is being squeezed and created as a product. It's the extract that we are taking from amla. So the kind of purity that it maintains is much higher. So the 1000 mg as such will be consumed by our body. So that is one main thing. And even when it comes to amla, it is said that from the tree, if you pluck it and consume it directly, it's good. But the moment it reaches about 15 to 20 minutes, this much of vitamin C gets reduced. Further 15 minutes again gets reduced. So whatever we are buying from the supermarkets, it must have come from maybe 2 3 days older. So that kind of purity is the main thing. So if you can get it from food sources, that's the best. But the ultimate truth right now, or the fact right now in the world that we are living right now, is that from the food sources we are not getting enough. We have to take food sources, but to complement that, definitely supplements is something which needs to come into every human being's life.
So, what about the vitamin D? Because natural sunlight is the best for the
Yeah,
vitamin D deficiency rectification. But same time, so many vitamin D tablets are also available. So,
correct.
which is the best option now? The natural sunlight or the tablet?
Definitely sunlight. No doubt about that. But at the same time, for things to happen internally in your body, definitely supplements is something which even the happiest thing that we all are experiencing right now is that even a lot of doctors are supplementing. I mean, they are prescribing supplements right now, including vitamin D, vitamin C, all those kinds of things. So definitely I would say the common answer to all comparisons between natural source and supplements is the same. Natural source, as much as you can get, that's the best. But for us in this present living environment that we are living right now, supplements is definitely a mandatory thing. Now the question is which brand to go ahead with. That we need to research and find out.
See, the intestinal cancer, the numbers are getting increased day by day in the last couple of decades. So, is it because of our food habits, or is it because of the supplement? Because nowadays supplement intake is also drastically increased, actually,
Yeah.
and or is it because of the excess usage of drugs? What is the root cause? Have you done any analysis on this one? Like, because you have done thousands and thousands of patients. Okay, you are
Yeah.
using your supplements. Have you
Yeah.
done any statistics of their reports and people who are not using the as a general case study? Have you done any comparison?
Mainly, yes, that's a correct point, because a lot of people are going through a lot of gut related issues nowadays. It's the intestinal cancer, all those kinds of things happens as a, the base cause definitely is that you're having a bad gut. I mean, basically that's the main thing. And research or science has proven that gut is considered to be your first brain, not even the second brain, because gut has a lot of neurons, much more neurons than your brain, is what research proves. So now taking care of your gut is the main thing. Now, for example, there are a lot of products that are coming in the market in terms of supplements itself, like prebiotics, probiotics, combination of pre and probiotics. We also have a product which is called Intute. It's not there in the UAE market right now, but in India we have, and it's giving a lot of good results to people. Now, gut related issues, it's not that difficult to find out, because daily we go to the loo, and we can definitely experience that, whatever the kind of gut related issues we'll be able to experience. And all these things happens as a result of definitely lifestyle only. I wouldn't say drugs, because we haven't specifically done a research as such connected with the drugs part or the medicines part, but definitely it's about the lifestyle, because when it comes to creating these lifestyle modifications for people, for our customers, we have seen an automatic change in their gut health as well. Like, for example, we are correcting a lot of nutritional things, diet related things, fitness related things to them. And as a result, people who are already facing some kind of gut related issues, they are having a positive result over there as well, which is definitely creating a lot of, it's creating a lot of positive impact in terms of of their overall productivity. When your gut is gone, it's like, we all know that if our gut is like in a mayhem, we are in a bad mood. So we normally say that if our gut is bad, I'm in a bad mood. Basically, it's connected. The brain and the gut is connected through something called vagus nerve. So that's why gut was considered to be the second brain. But now bigger researchers who are doing research in the for the gut and things like that are saying us gut is our first brain, because whatever is there inside your brain, the neurons, neurochemicals, much more than that is there in your gut. That is where it gets produced. It's is what is being said. Like, for example, a lot of neurochemicals like serotonin, which is a happy hormone. I mean, serotonin is a hormone that gets produced, but serotonin is something which people used to think that is being produced in your brain, but literally much more serotonin, that is that neurochemical, is being produced in your gut, is what research has proven. So that is a very very crucial part of the entire body. And if you take care of the entire lifestyle as such, it is automatically giving a positive impact to the gut, is what we have seen. Like diet or even exercise has a big impact on the gut health. And if you correct that gut health, definitely the intestinal cancers and all those kinds of things will definitely come below the whatever's being seen right now. I think in the last about 10 years, the kind of news that are coming out is in big numbers. We're seeing a lot of cases like that. But before that, what it was is a question. Mainly, it's the lifestyle. I would say it's basically about the lifestyle, the kind of uh, accessibility that we have towards all kinds of lifestyle, like junk food or whatever it is. The accessibility has increased. If you look at the UAE market or the Indian market, we don't move much. Anything is there on our fingertips. Let it be food, let it be anything. Groceries, we don't go to the supermarket to buy groceries now. We just order it online. We are having an idle lifestyle. That is also a main point behind, or main reason behind all these.
See, what I have personally noticed is that in the last 1 year, so
Mhm.
many new companies, actually, many people personally came to me with complimentary thing. Complimentary means they said, just try this probiotics or something. Okay.
Uh-huh.
And they said, okay, you just try it and take a course, and it is so expensive.
Oh.
The thousands of dollars they are charging. And
Mm.
they say that if you have it, your gut biome issues, everything is solved. A lot of bacteria it creates, and all stories I listen. Is there any
Yeah,
fact in that one? Is
absolutely.
there any
Because
measuring is there any measuring system before
yeah,
consuming and after consuming, and what is the result? Any analysis has been done?
absolutely, absolutely. There is something called the gut microbiome test. We are also
Hmm.
doing a lot of research on that aspect, and trying to come up with a gut microbiome test as well. Because when it comes to your gut health, that is the best thing, and before after is clear. Like, for example, there are big companies in the US who does this, and I think as time goes, the cost is coming down in a big way. Like, for example, around 5 years back, when the gut microbiome test was introduced in US by a company, I think the price was, as you mentioned, the price was around $1,200 or something. The same company, the same test, they are selling right now at about $250. Now it's coming down. The price is also coming down because the technology is advancing likewise. So yes, gut microbiome test is a very very useful thing. If someone has recommended to you, just check
Then
about the
not only the
credibility
test, actually, they are giving some kind of solution or
product.
some liquid. Actually, they said just
Ah, okay.
consume it. Okay, and
Ah,
once you start consuming it, you need to use it for 1 month or 2 months. Okay, continuously. I don't know,
correct.
because I am a skeptic also, because uh,
Yeah,
is
yeah. A
is
lot
it
of players.
genuine or
Yeah.
not? I have no idea. I have
Um,
lot of complimentary stuff coming to my home, and I don't know why all of a sudden so many companies coming to the picture with the different brand names.
yeah, mainly because I think the boom in the health and wellness industry post COVID is huge. That must be they are seeing everyone is seeing a big scope in the industry. So that must be the reason why they're coming up. And definitely the gut health, as we were discussing, that is also a big, that itself is turning out to be $1 billion industry as such. Inside the health and wellness, just the gut health. So there are many companies, even in India, there are many companies who are completely just focused on gut health, nothing else.
Okay.
They don't talk about anything else, just gut health. They have
Okay.
products, they have gut microbiome test. I think there are companies in the UAE who are already doing gut microbiome test, but it's really good. I wouldn't say that it's a gimmick, but as long as you can just check the credibility of the company, you can confidently go ahead. Is my opinion.
Okay. Okay, we discussed so many things in detail. Okay, now tell us, okay, as a fresh entrepreneur, and okay, well, of course, you get the blessing from your father,
Yeah,
but what is your experience like starting as a startup venture,
yeah,
especially when you started something during the COVID,
yeah.
and what was the biggest hurdle you faced, and how did you overcome that?
So the main thing is, since this was connected with genetics and things like that, the initial thought was that okay, we will route it through doctors, and that was the main concept that we had, because doctors, clinics, they already have clients. So we thought we will plug our service into them. So I had approached a lot of doctors back in India. I think I must have met about 50, 60, 70 doctors, out of which around 90% was a get out. So that was one major hurdle, because the awareness of something like this was very less. So that was the main thing. This was we were not introducing something that was already established in the market. We wanted to make people aware about this. Only advantage that we had was that due to COVID, people were open towards listening to something like this. Before that, people were like, ah, chod do. That was the kind of approach that they had. But after COVID, when we talk about preventive health and we talk about these kinds of technology or techniques or tools, people are open to hearing about that. So that was an advantage. But at the same time, the challenge was definitely the lack of awareness. That is the single answer that I have. Even now, we have that challenge. I'm not saying that we have overcome that challenge completely, but maybe because this is a bit futuristic. So maybe 5 years down the line, 3 years down the line, that challenge will be overcome, and we can move in a big way. So lack of awareness was the biggest challenge, and creating that awareness, we have spent a lot of money on creating that awareness. Like for example, back in India, we had our equity partner as Sunil Shetty, the Bollywood actor Sunil Shetty. He just took an exit recently, but he was there as our equity partner, and he has also helped us in spreading the awareness across. So those kinds of a lot of efforts were taken, and still we are taking back in India, and in UAE we just started. So that is the main thing. Lack of awareness is the main thing that we were facing as a challenge.
Okay, what is your goal like? You are focusing on the premium level customers only, or for the entire public? Is it affordable? What about your product? Is it I don't know the price range or
Yeah, yeah.
something, but what is your targeted customers?
So when it comes to supplements, it's for everybody, because from an Indian context, if I may say, it starts from all the way from about 750 rupees. So
Okay.
it is something which is affordable for everybody. But when it comes to the genetic part, as of now, I would say it is for middle and upper middle class when it comes to the affordability. But we are trying to bring in all kinds of solutions for maximum people to afford it. Like for example, when we started off, the price of the same thing was 52,000 in India, that we brought it down to 35,400 right now. So now it is being said that maybe in the next 4 to 5 years down the line, or maybe even after that, it is being said that the kit that is used for collecting the sample will become more costly than the test as such. That means the test will be so cheap, just like a normal blood test. That is the way things are going. Now, I think as we move on, it will the kind of affordable class or affordable number of people will increase. But right now, for that process, our target customers is middle and upper middle class, and they are the ones who we are getting right now. But as we move on, that will change. But at the same time, we are, as I said, we have collaborated with a lot of financial companies back in India for providing EMI facilities, all those kinds of things. So we are trying our level best to reach maximum number of people, because when it comes to the utility of something like this, it's something which should not be differentiated based on the kind of financial affordability or whatever that is. Everybody should be able to afford something like this. So that's the aim that we have. We have to go ahead because, as I said, our ultimate vision is to create 1 billion biohackers. So to make that happen, it has to be affordable for everybody. So it will become affordable.
So, what is the consumption process like as an unknown person? If I get into this thing, from
Yeah.
where to start, how to get the awareness, from where, who will guide me, and how long it will take? What is your process like?
So we are doing a lot of campaigns on the digital space mainly, because social media, as we all know, is one main hub where everybody is there. So through that, we create the awareness, we create the interest of people, and we generate the leads. And we have a team back in India, and over here in Dubai also we have a small team. But in India, we have a bigger team. We have about 35 to 40 people working with us, who are consisting of callers are there, genetic experts are there, doctors are there, everybody is there. So how, as a customer, when, say for example, as a layman, I see a ad campaign of Eplimo that is coming under vroots on my Facebook or Instagram or wherever, LinkedIn, wherever it is, and I click on that, I can book a free consultation with our genetic experts. So the genetic experts will do a consultation and will explain to you what Eplimo is and what is the kind of benefits that you will be able to derive from this, and then they get converted as a customer. So once they take the Eplimo, the kit, the sample collection, saliva sample collection kit, will be shipped to their home or office wherever it is convenient for them. They can collect the sample. We will be taking it back, sending it to our lab, and after that, about 4 weeks, 3 to 4 weeks down the line, the report will be ready. After which the customer will be getting a full-fledged counseling as well from our geneticists, because once I see the report, I may not be able to understand completely as a layman. So that's where our experts comes into the picture, fix up an appointment with the customer again, and over a Zoom call or a phone call, whichever is convenient for the customer, the entire report will be explained in a very common man's language so that they exactly know what are the kinds of steps that they need to take in their lifestyle. So this is the entire process.
So, the lab is in India or lab is abroad?
In India, in Hyderabad.
Okay, okay.
They are the first labs, I would say. They started off on another around 30 years back. They started in Hyderabad. It's headed by one Dr. Anuradha Udumudi. So Dr. Anu was the head of research laboratories in the US. So she
Okay.
quit her job over there and came back to India, saw that scope, and started the an own it's actually a four-storied building,
Mm.
completely full-fledged genetic lab as such.
So, what are your future plans like? What is your next 5 year plan or?
Yeah, so it's basically more than expansion, I would say expansion within India. That is
Okay.
one main thing. Along with that, UAE, because UAE is definitely uh, I would say another part of India. So that
Mm.
kind of an audience is what we have over here. So that's the main thing. In the next 5 years, we want to tap into at least we want to tap into another maybe a million people. That is what we are looking for, to generate that kind of awareness. That's the main agenda that we have for the next 5 years. And yeah, from a business point of view, yes, we are looking for fundraisings and things like that, because this is something which needs to blast off. We need to
Mm.
do a lot of promotions. We need to create that kind of a hype and things like that. So those are the some of the plans. So but from a numbers angle, in the next 1 year, we want to touch 1 million, 1 million
So,
people, 1 million lives.
okay. So, it was a great talk. And before concluding, tell us about your personal thing. Are you married or still a bachelor or?
I am married. I have been married since the last 4 years. Me and my
Yeah.
wife right now moved to Dubai around 6 months back.
Okay.
I was here since the last about 2 years. I was on and off, but in the last 6 months we completely moved here. Now
Okay.
living here, and just started our UAE life. You know how the start and things like that are much more. So
Mm.
yeah, that's the personal life all about. And yeah, I at back home, I have my dad, my mom. I have a
Yeah.
younger sister. I have my grandmother. My wife's mom is there. My wife's
Okay.
brother is there. So that is the family.
Okay. Anyway, thank you very much. Since we both are in UAE, we will meet again. And
Absolutely, sir.
I wish you all the best, and because young entrepreneurs, they are the future for the industry and the society, and expecting more and more products and services from you. Thank you.
Absolutely.
Thank you
It's an
so
honor
much.
to be with you for the last 1 hour. Thank you
Yeah.
so much for the time, and it's a pleasure. Yeah.
Thank you.